Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, and urgent care. I'm affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of our health talk today is dentistry, dental hygiene, and more. Joining us today as our guest speaker is Dr. Adeeb Haque, who is practicing dentistry in the local areas, and he is going to highlight our viewers the importance of daily checkup and of your teeth, about the implant and all that. So good morning, Adeeb, and thanks for joining me today on Health Talk.
Good morning, Dr. Prasad. Thank you so much for having me on your show. As Dr. Prasad mentioned, I am a general dentist, and I own my practice in Livonia. My practice is Maple Dentistry. We're located at 5 Mile and Farmington Road, right in the heart of Livonia. And I've been practicing for 8 years, and I do the whole gamut of dentistry from, bread and butter, fillings, crowns, bridges.
Okay.
We do surgery and extractions, and then cosmetic dentistry as well, implant placement. So I'm happy to be here, and I appreciate the opportunity.
Yeah, I'm so proud of you because I used to see you when you were young.
Yeah.
You came to show sometimes with your mother,
Right.
which I respect her a lot.
Yeah.
So now you are a full-fledged dentist,
I
and
am.
people like me and all, we need your help.
Absolutely.
So, can you please tell us how has dentistry evolved over the years, and also what advancement excite you?
So I think the first part of your question, there's been tremendous advances.
Exactly.
There have been a lot of advancements. I know people who are a little bit older than myself, when they would go to the dentist, it'd be painful, it'd be fearful, and I have so many patients that are still nervous to this day to come in. But we've been able to create techniques, and materials have changed, so they last a lot longer. We have techniques and anesthesia itself.
Right.
So it's painless now. And so a lot of my patients, the biggest compliment I get is after they've had their procedure, whether it's a crown, filling, surgery, whatever, they always say, oh, I didn't feel anything. And that's the biggest compliment because
that is true. Yeah.
I've had too many people, who have sweat in my chair and, they've lost a few pounds just sweating with nerves. But that's probably the biggest way that things have changed, for sure.
I tell you, modern science has advanced so much, Before you go to the dentist office, they used to do so many procedures. Now, everything seems like even the tooth extraction. Everything is there's a lot of changes.
Yeah. I think the biggest thing, to answer the other part of your question too, is the biggest advancement I think I'm most excited about is how we can utilize implants to replace teeth that people unfortunately lose for whatever circumstance.
Exactly. Yes.
That would be, and then intraoral scanning. So in my office, for example, we are up to date with most of the latest technology. We have the intraoral scanner, which is state of the art. We have materials that are all
modern,
top end
yes.
stuff. A lot of people ask me, do you do silver fillings? While silver fillings are fantastic, I do the tooth colored shade.
Yeah.
So we can match things, so you can't even tell that you've had dental work done.
I know. I was going through all those researches, what has been done, in dental health, and I'm really amazed how much science has advanced. So now the question is, what are the preventable dental issues? Would you like to tell our viewers about?
I think the biggest things that you can prevent is, the whole adage is an ounce of prevention is worth a pound of of cure or
Yes.
medicine. And so in dentistry, the biggest thing is prevention. And so just going in, getting your checkups, whether it's every
Regular
6 months or so,
checkups, yeah.
at least every 6 months getting checkups, because it's much easier to catch something when it's small rather than large, as you know.
That is true.
So that's where checkup and maintenance is so important. And I think a lot of people just choose not to, or they take it for granted, whether it's cost, whether it's fear, or what have you, or access limitations as well. But thankfully, we see most people. We're happy to see whomever, whether you have dental insurance or you don't have dental insurance. We make it affordable, and we work with you to make sure that
With
you
the
get
insurance and everything is covered.
we take the majority of dental insurances in my office. So I'm happy to say I have a whole gamut of people.
Right,
But prevention, I think the biggest thing is
regular checkups.
regular checkups, and then
Eat
getting your
healthy.
getting your cleanings, and obviously hygiene at home. You gotta.
Right,
Flossing has there's a reason we
I
say to
know,
floss, and I know most people take it and they floss when they go to the dentist, but daily flossing and brushing at home, in addition to getting the checkups, make a world of difference.
Right. And being a pediatrician also, I advise all my children, whom I see parents, I advise them to start getting dental checkups since the baby is like a year old.
Well, that is exactly true.
1 year old.
So at 1 year old, typically, the guidelines are typically once you start seeing the first tooth in the baby's mouth to bring them in, but oftentimes that might be 6 months, 7 months, and it's challenging to see them. But it's good to make sure that there's nothing, tongue ties. I'm sure with your history in pediatrics.
That's a very important issue that we don't want to miss in the babies.
Exactly, and a lot of times, it's not caught, and dentists will catch that, or there's other issues with the
uvula and
So with the uvula, with the airway breathing, and even especially with young children, a lot of the misconception is that baby teeth are going to fall out, but they dictate what's going to happen in the adult teeth. And so if you have an infection in the baby tooth and it goes unchecked and untreated, it's going to then cause issues with development.
Yeah, which is an excellent idea for the pediatrics guidelines,
For sure.
about baby checkup. There's a whole guideline. 6-month checkup, 1 year dental checkup.
Absolutely.
Of course, cleft lip is very obvious, but tongue ties, those are the things that needs to be taken care of.
Tongue ties, as well as there's like high frenum attachments. You can adjust that as well, and that causes issues with breathing, with ability to sleep. Airway is another really big one in pediatrics.
Very important.
Because one of the things that I recently learned, and I keep up to date with all the new research, and at the office we see the joke is that I say from the womb to the tomb that we see everybody. So we see children 6 months, a year, all the way up to I think my oldest patient is 101 years old. And so we see everybody, we can service everybody, and so with children, for example, if they're below the age of 5, one of the things that parents don't know, and I myself learned in the past 2 years, is actually that if they are making noises when they're sleeping, if they're under 5,
snoring is a big factor. Where
that means there's an airway issue.
Catch up about the airway.
Yeah, and that'll cause issues with their mental acuity and so forth. So it's very important, and we often catch that first when we're doing our oral exams.
Right. Yeah, very important.
Yeah.
So how do you treat those patients who are nervous?
So the biggest thing,
I am glad you added that as one of the questions, because I can see the nervousness, anxiety in every age group, not just the kids, in adults.
Adults might be more nervous than children a lot of times.
I know, and senior citizen like me even more.
Well, because they didn't have anesthetic back in the day. And I remember there was one patient that I had, I think she's about 85, and she said, when I was a kid, I'd go to the dentist here and there, and unfortunately, I didn't come from a very wealthy family. And so at that point, it was an additional $1 to get anesthetic, to get the work done. And her parents were like, no, we're not going to spend an additional $1. So that traumatized her because it would be more drilling, on teeth that, are not anesthetized, and that's uncomfortable. But as far as what we do, we offer different methods. We have nitrous
local
oxide.
application also.
We do local. We always do local anesthetic.
Lidocaine, local plus.
Correct. Lidocaine, septicaine. We have local anesthetics that we obviously do, but just for nervousness and so forth, we have nitrous, which is like laughing gas, which helps to calm you down.
I was going to ask you about the laughing.
We have that in the office.
That helps,
We do oral sedation, like light oral conscious sedation in very severe cases. We can do sedation as well. I work with some of the specialists where they can also put you to sleep if you need to get the work done and you're just too anxious. And the needles are what makes people the most anxious.
Right.
Or
don't look at the needle.
That or the noise. But also we have TV, so we play whatever you want to play on the TV.
Right,
So that kind of helps calm people down. I think the biggest thing is a gentle touch. For me, it's about not just my know-how, my actual experience and my hand skills and so forth and my technical ability, but I try to deal with every patient compassionately and listen to what they're looking for, and then we work together to create what do we need to do, what are the goals, what are the that we're trying to achieve.
So most important thing, Adeeb, is to establish a patient-doctor relationship.
Absolutely.
Right? Because working at the emergency room, when I used to see the little kids, laceration in the lips and bleeding around the gum, they cry. Of course, they will cry.
They're going to cry.
Yeah.
It's going to be uncomfortable.
You cannot stop them from crying. But the most important thing is just talk to the mother or whoever holding the child. And that plays an important role,
Absolutely. I couldn't agree more.
Yeah.
Couldn't agree more.
Patient.
You have to have that. You have to have that connection with them.
Yeah, I remember, one time emergency room, I had a little child, like 3, 4, a small laceration on the tongue. And then, you have to take the tongue out and put a little. So, it was really hard those days.
Yeah.
But now you have so many ways also to sedate them and, and do that. So now we talked about the importance of regular checkup, and cleaning.
Yeah.
So would you like to know, our very favorite topic is the dental implants.
Yeah.
Because I tell you, you will have a lot of senior citizens who are looking for the dental implants as the time progresses.
I think tooth loss, unfortunately, my goal with every patient is to maintain and save as many teeth as possible. But in those cases, sometimes you can't, and you have to lose a tooth, whether it's because it's broken, whether it's because of pain, what have you. And infection is a big one too. And in those cases, oftentimes we need to replace teeth. And so when we were talking, I'm so happy that you asked what about dental implants, but also about what's changed in dentistry. But I think implants are the biggest thing that have changed.
Yeah, right.
In addition to other services that we offer, we've become better. But in terms of dental implants, they've become much more predictable, which has brought the cost down. And I myself take great pride in being able to provide that service, to place implants from start to finish and restore it and so forth, to restore someone's smile. Because, that's one of the first things you notice when somebody's talking is if they're missing teeth or if you're smiling, and your confidence is from there.
Right,
and the ability to eat. A lot of people take for granted the ability to eat, and that's not. You don't want to be living on applesauce the rest of your life or very soft foods. I think most people like to eat.
That's true.
I like a good pizza or a sandwich, but you got to be able to chew it, right?
Chew it. Yeah,
so in terms of dental implants, they are, as I tell my patients, they're a one-for-one replacement most of the time for a single tooth. although we can utilize implants for replacing multiple teeth at once as well, and that gets into dentures, and if you have to lose all your
Right,
teeth, we can do
yeah.
implant-based dentures as well. But if you're losing a single tooth, ideally we can place an implant because then it allows us to singularly replace it. And the implant itself is like a little titanium screw that goes
Yeah.
into the bone. It integrates into the
I
bone.
know there are beautiful illustrations,
Yeah.
about those different kind of
Yeah.
implants and
Yeah,
which one
and
is
so
good.
we do implants, and we can place them, and then you can replace the tooth, and it's a very painless procedure. It takes, it doesn't take a lot of time, but it provides you a ability to chew and replace something that would be much more difficult to replace otherwise. So you don't have to wear, if you're familiar with what a partial denture is.
Right. Yeah.
Some people that's removable. That goes in and out of your mouth, and a lot of people don't like that. It
Yeah,
then clasps on your teeth, or a bridge is what we used to do.
Right,
But sometimes
yeah.
you can't do a bridge, and so implants, I would say, are the standard.
Easiest-
They're their standard of care.
Most
honestly,
standard care.
they are
is,
the standard of care for a single tooth if you're missing one.
Yeah.
Granted, there are exceptions in situations we can't do it, but most of the time we can, and I always recommend that's one of the best ways to do it. However, we have a multitude of
Different,
options of what we can do. Implants are not the only one. They're something I like and I think are a great tool really to replace teeth and to help people.
Yeah.
So
So basically, can you tell our viewers about the gums diseases? Because as you progress, as you age, you develop the gums.
You're more
issue too,
susceptible.
The gum receipts. So can
you can have your gum receipts. So
yeah,
checkups
for
are
our
a big thing.
viewers to know.
Yeah, so periodontal disease, I think, is one of those
Yeah.
diseases. It's, I think the most recent statistic that I read said that about 70% of people have periodontal disease.
Yeah.
Part of that's due to a
Aging
age range.
process
The aging
receding.
people are, the baby boomer generation is, still
Right,
very
yeah.
large, and so people are aging more, right?
Yeah.
The proportion of people who are below the age of 40 is still lower than the people who are above the age of 40.
Right.
And so as you age, oftentimes, yes, you can have recession. Sometimes our hygiene is a bit more compromised because we can't brush and floss as easily.
Right.
And we get bone loss. And periodontal disease, in essence, is just losing bone that's foundational around teeth.
That is an important factor, bone loss.
Yes, and that's due to the plaque, and that's due to the bacteria that's in the mouth. Obviously, we always have
Yeah.
bacteria in the mouth, but we want to make sure that it's more good bacteria to bad bacteria.
Bad
And when
bacteria, right.
that shifts and we have more bad bacteria, that's what will cause a lot of periodontal disease and bone loss, and then we get teeth that become loose, we get infection, and it's an infection. The same plaque that is causing periodontal disease, for example, has been found in the brain to cause Alzheimer's. It's the same plaque. It's in the blood. So that's why it's so important that, healthy mouth is the gateway to the rest of your body. So,
Yeah, it's very important.
very important. Yeah.
Because see, the chewing, as the age advances, it's hard to chew. The things get stuck around the gums, and then the gums start receding.
They start to
So
have
one
irritation.
thing leads to other, like
Yeah.
bad teeth, cavities, gum receding, and then goes
It's
the
a snowball. It's a snowball effect. That snowball
The
gets larger and
snowball,
larger.
yeah,
So
it
let's not let it get too big and become an avalanche, right?
Just like, that's right. So there are so many kinds, when I was doing Google search and all those, so many different kinds of dental implants in the market. So what do you think about 3D printing and digital? Is that something that I should be know?
3D printing.
Industrial implant.
Which one?
Yeah, industrial implant.
Industrial implants. Yeah, those are implants.
Subperiosteal, yeah.
Yeah, so industrial that just depends on where you're placing the implant, where it's coming out. We typically want it to be completely in bone as much as possible.
Okay.
Maybe a little bit above. Again, that depends on each patient and the jaw on the bone and so forth. And
Right.
that's when you have a good dentist or surgeon or person that knows who's done implants enough, then they can plan accordingly. I think that technology and digital scanning is amazing. I have a digital scanner in my
Yeah.
in my dental practice, and it helps create a very efficient workflow, so it's easier for the
This
patient.
is something new, right?
It is. I would say intraoral
Yeah, the
scanners. They've been
imaging,
around for a while.
Yeah.
They've been been around for a while, but I think the more tools you have in your toolbox, the better
Better it
it
is.
is for you typically. So you're not going in blind. I think in the past, we placed implants, we would do surgery, we'd do anything with a little bit of information. Now we can gather so much that it makes it so much more predictable and therefore a better outcome for every person. So like we have a CBCT in our office. I have a digital scanner, and I can merge everything together and create a good plan to place implants, or even just to look at surgery or do any sort of work to make sure we avoid complications as much as possible. So 3D printing is something that's still a little bit newer to dentistry, but there are a lot of applications where 3D printing is phenomenal, especially
the results are great.
The results are great, and I think it just only can get better. And, that I think that's with everything. Technology is helping, and it's just a matter of how you implement it into your practice
so
and whether you're willing to put it in.
Yeah, subperiosteal, that is the recent one, right?
Subperiosteal implants, they are, and they have their specific applications. Most of the time, you're going to be talking about the endosteal, so you're mostly in bone, because bone dictates how your implant is going to be successful.
With the tissue around.
Yeah, correct.
Yeah. So it's amazing. There are so many.
It's a lot. The advancements are wild to think about. Even from when I started my career to now, there's been so much.
See, right?
Yeah.
So if I am a candidate for dental implant, how long do I give myself the period? Like it is 1 year, 2 years before everything is done. From the time I see you, what is the duration of time that I will be done?
So let's say you're coming in and you have a broken tooth that needs to come out.
Okay.
That's going to add a little bit of time, but
so
I would.
First tooth extraction.
So you would take the tooth out. We always graft when we take teeth out.
Yeah.
So that from extraction to then end grafting to then allowing that bone graft to take in to let it heal up. Usually that's somewhere in the 3 to 4 month span.
Okay.
And then at that point we can then place an implant. Hopefully, the bone's healed up and it's done what we wanted to do. We place the implant. Again, that's another 3 to 4 months for healing. And then after that, it's
like 2 years.
Not 2 years. Usually within 9 months, I would say.
9 months. Okay.
And that's assuming the worst, which means that it takes you a while to heal, things move slowly.
Right, yeah.
But oftentimes, if you're coming in and you have your bones already healed up, and we can place an implant and be ready to go within, within less than 6 months.
So for our viewers
depends.
to know, the whole duration for an implant is around 9 months to a year, right?
That's
them some
oftentimes, but that's on the very conservative end. We could do a same day where we take teeth out and we place the implant immediately and graft all together. But again, that's a case by case basis. I always like to be more conservative with things because if we can, if we under promise and over deliver, then that makes it. I like to have the worst case scenario for patients in surgery because you never know, and I'd rather know the worst case so I'm prepared.
Sure. So you're prepared for.
So I'm prepared, but also so I'm creating expectations so we're all going to be on the same timeline.
So that's good. It's good to know you have provided us so much information. Now, one thing I want to ask you, which is a good antiseptic to gargle with Listerine? Which kind? The green kind or yellow?
So
when I go to the drug,
so mouthwashes, there's 50
So
on the
many
market.
yes.
I always recommend you do not want to have something with alcohol in it. You want to have
Yeah,
alcohol
right,
free
yeah.
because that
No
will burn your
alcohol.
tissue and it's not going to be good for
Yeah.
you. You want to get something that has fluoride in it, ideally, and that's going to be the best thing. So,
Yeah.
like Crest Pro Health is a really great one. Listerine has a no alcohol
No
one.
alcohol.
There's TheraBreath.
Peroxyl and so many kinds.
Yeah, there's Scope. There's a multitude out there, but ideally you want something with fluoride in it. So there's ACT mouthwash, which is a fluoride mouthwash. There is a Crest
So
Pro
many.
Health. Yeah, there's so many.
But
So
still, salt and water gargle is good.
Salt and
The
water
best,
gargling is very good, too.
Reduces the swelling.
correct. That is
Yeah.
fantastic too.
So that was good.
Yeah.
You provided us with lot of information. Last 1 minute keynote for our viewers. What would you say?
I would say, please give us a try. First of all, if you're here in the Metro Detroit area, my practice, Maple Dentistry, is in
Yeah.
Livonia at 5 Mile in Farmington. You can check us out on the web at mapledentistrymi.com. But I would say dental health is something, and oral health in general is something that's
Very
very important,
Yes.
because we're not just cleaning your teeth. We're not just checking up on to make sure do you have a cavity, which is an
Right.
infection or broken teeth or
Yeah.
wear down or anything. We're also checking oral cancer. I just saw a patient the other day, and I noticed something in her mouth, and I said, "This looks
Something
This looks a little
suspicious.
suspicious. Normally you wouldn't think so. It changed color a little bit." I sent her. It was we got a biopsy done, and it was in fact some carcinoma. So, but we're
those are
catching it.
the things,
But it's
yeah.
very well. It's
Right, yeah.
easy to deal with earlier. So she has a much better,
Earlier, you say so.
like with anything.
So I like to thank you today,
Thank you.
Adeeb, for coming to my show. You provided us with so much information. We could not talk about what are the underlying diseases
Right.
that cause like diabetes,
Correct.
high blood pressure. And
Well,
all
next time
those.
I can always come in.
I know.
Maybe part
I
2
know.
will do.
Part-
yeah.
So I like to thank you for providing all the informations about this. And then I like to thank our viewers for watching me
Absolutely.
on My Health Talk. The dentistry, keep a smile healthy and
Yeah.
bright with our famous young dentist, Adeeb Haque.
Thank
And
you so
until I see you all again, have a safe summer. I'd like to thank our viewers, about our producer and the camera people. Thank you again.